Pulmonary embolism is one of those medical emergencies that can strike without warning, a silent threat that turns an ordinary day into a fight for survival. It occurs when a blood clot, often originating in the deep veins of the legs, travels through the bloodstream and lodges in the arteries of the lungs. This sudden blockage prevents the blood from reaching parts of the lungs and exerts enormous strain on the heart. It can disrupt lung function and cause circulatory collapse, shock, and death. Yet, despite its seriousness, pulmonary embolism is treatable when diagnosed in time. Modern medicine offers effective therapies that can restore circulation, prevent new clots from forming, and save lives. Understanding the warning signs and acting fast can make the difference, because when it comes to pulmonary embolism, every second counts. Pulmonary embolism occurs when a clot or thrombus that has formed in a vein breaks off and travels to the lungs. This condition is not a separate disorder, but rather a complication resulting from deep vein thrombosis. The broken off clot, now referred to as an embolus, typically originates from the deep veins of the legs, but it can also come from pelvic, renal, and arm veins, as well as the right ventricle of the heart. Several conditions are closely associated with thrombosis, including major surgery, trauma, prolonged immobility, heart failure, postmyocardial infarction, malignancy, pregnancy, obesity, varicose veins, advanced age, and a previous history of thrombosis. Once the embolus reaches the lungs, if it's massive enough, it can lodge in the branches of the pulmonary artery, causing circulatory issues of varying severity and increasing the strain on the right side of the heart. If the increase in strain is severe enough, it can lead to sudden right heart failure. Smaller emboli often block the small blood vessels in the periphery of the lungs, which may result in pulmonary infarction. In many cases, pulmonary embolism develops silently, producing few or no noticeable symptoms. Small clots can pass into the lungs without causing significant disruption to blood flow, making the condition difficult to detect in its early stages. However, when the larger clot lodges into one of the major pulmonary arteries, the effects can be sudden and dramatic. Typical symptoms include sharp or stabbing chest pain that worsens with deep breathing, shortness of breath, rapid or irregular heartbeat, dizziness, and sometimes coughing up blood-tinged sputum. The skin or lips may appear bluish due to lack of oxygen in the blood. In the most severe cases, when a massive clot blocks one of the main blood vessels supplying the lungs, blood flow to a large portion of the lungs stops abruptly. This can cause a sudden drop in blood pressure, collapse, or even cardiac arrest, making it a life-threatening medical emergency that requires immediate intervention. Surviving a pulmonary embolism is often only the first step in recovery. For many individuals, the effects of the condition can linger long after the initial event. Studies show that nearly half of those who survive continue to experience some degree of reduced exercise capacity, shortness of breath, and fatigue even a year later. Simple daily activities such as climbing stairs or walking short distances may leave them unusually tired or breathless. These ongoing limitations can significantly affect a person's quality of life. Persistent obstruction or damage to the pulmonary vessels leads to a serious complication known as chronic thromboembolic pulmonary hypertension. This condition occurs when blood pressure in the lungs remains abnormally high due to unresolved clots or scarring, forcing heart to pump harder to circulate blood. Over time, this can cause progressive heart strain, worsening shortness of breath, and eventually right heart failure if left untreated. The diagnosis of pulmonary embolism begins with a comprehensive clinical evaluation. The doctor first takes a detailed medical history, paying close attention to the patient's symptoms as well as any underlying conditions or risk factors. It is also important to review all current medications. as some drugs can influence clotting tendencies or interfere with diagnostic tests. A series of diagnostic procedures follows a physical examination. An electrocardiogram or EKG is usually performed to assess heart rhythm and identify possible strain on the right side of the heart. Basic laboratory tests are then carried out, including the measurement of D-dimer level, a substance released when blood clots dissolve. Elevated D-dimer values can suggest the presence of an active clotting process, although the test is not specific to pulmonary embolism. The patient's blood pressure and oxygen levels are carefully monitored, and an ultrasound of the heart may be performed to detect signs of right heart overload caused by increased pressure in the pulmonary arteries. If pulmonary embolism is suspected based on these findings, the next step is a CT pulmonary angiography, a specialized CT scan that visualizes the pulmonary arteries in detail. This imaging test can precisely locate and measure the size of the clot, confirming the diagnosis with high accuracy. In situations where CT imaging cannot be performed, such as in patients with kidney problems or contrast allergies, a ventilation perfusion scan, also known as lung scintigraphy, may be used. This nuclear medicine procedure evaluates airflow and blood flow within the lungs, helping to identify areas with impaired blood flow. Though used less frequently today, it remains a valuable tool when CT scans are not feasible. Pulmonary embolism is a medical emergency that demands rapid recognition and immediate treatment. The outcome largely depends on how quickly therapy is started after the onset of symptoms. Depending on the severity of the circulatory disturbance and patient's overall condition, treatment may take place in a cardiology unit or in critical situations within an intensive care setting, where continuous monitoring and emergency interventions are available. The cornerstone of therapy is the administration of anticoagulant medications, commonly referred to as blood thinners. These drugs do not actively dissolve the existing clot, but instead prevent new clots from forming, allowing the body's natural fibrinolytic system to break down the blockage gradually. Anticoagulant therapy is typically maintained for 3 to 6 months. Though in patients with persistent risk factors or recurrent clots, it may be continued for a longer period, sometimes even lifelong. In severe or life-threatening cases, when a large embolus obstructs major pulmonary arteries and causes cardiovascular collapse, more aggressive treatment may be required. This can include thrombolytic therapy, where powerful medications are used to dissolve the clot, or surgical embolectomy, a specialized procedure that can be used to physically remove the clot. Such interventions are reserved for hospitals with the necessary expertise and equipment. The prognosis varies widely and depends on several factors, including the size and locations of the clot, the speed of diagnosis, the general health of the affected individual, and how promptly treatment is initiated. When recognized early and managed appropriately, the outlook is often favorable, and many patients make a complete recovery. However, in some cases, lingering effects, such as reduced lung function or elevated pressure in the pulmonary arteries, that is, pulmonary hypertension, may persist, requiring long-term medical follow-up. Pulmonary embolism is a condition that demands both awareness and urgency. Although it can develop suddenly and lead to severe complications, it is also one of the more treatable cardiovascular emergencies when recognized in time. Early medical attention, accurate diagnosis, and proper therapy can dramatically improve outcomes and prevent future episodes. Understanding the warning signs, such as unexplained shortness of breath, chest pain, rapid heartbeat, or sudden dizziness, is essential. These symptoms should never be ignored, especially in people with risk factors like prolonged immobility, recent surgery, or history of blood clots. With prompt treatment and continued medical follow-up, most patients recover fully and regain normal lung and heart function. However, awareness remains the most powerful tool in reducing deaths from pulmonary embolism. Recognizing the danger early and seeking immediate medical care can truly be the difference between life and death. If you found this video helpful, consider subscribing to more educational content. Have a great day.